How to get rid of triple eyelids. My left eye has 3 eye creases, or sometimes more. It started a few years ago, but it has gotten worse since I lost some weight a year ago. The left eye looks really tired compared to the right. I wanted to know what would be the best way to fix it and how much the cost would range from.
Thank you for your question. You submitted a single photo and you are concerned about the triple eyelid fold in the left eye. And you state in your question that you are concerned that there's more folds in the left eye, that it's gotten worse after you had lost some weight, and you feel like the left eye looks more tired compared to the right eye. And you want to know what's the best way to treat this. Well, I can give you some guidance based on the photo alone, but I would say that in a situation like yours, it does require proper examination to really give you what I would believe it to be the best option. And this is just the reality when it comes to the subtleties of making these types of decisions. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I specialize in cosmetic and reconstructive surgery of the eyelids. I perform a lot of Asian eyelid surgery as well as surgery that is related in terms of combination procedures such as Asian eyelid with ptosis surgery. So let's begin with first understanding a little bit about the difference between the creases of the two eyes. But before doing that, let's look at the eyelid height. See, when you say that your left eye looks more tired than the right eye, I would say there's two elements that are contributing to that appearance. One is the relative position of the eyelid relative to the pupil being the center part of your eye. When you look at your two eyes, the left eye appears to be slightly lower than the right eye. Now technically we can use a term like the word ptosis. Ptosis meaning drooping of the eyelid. Now that's a bit of an important distinction to be made with proper physical examination, because the degree of ptosis matters when it comes to making a decision about correction. Is the left eyelid that much lower than the right eye that is making a big difference, or is it only slight? Now that's a question that comes out when you review multiple photos, when you do a proper examination. You see, within the normal population, it is normal to have a slight difference between the two eyes, usually within 2 millimeters. If it's greater than 2 millimeters, then people are really much more aware that one eye is different from the other. So then the contribution then becomes the question of how much of the relative, quote, hollow of the left eye is there compared to the right, contributing to that tired appearance. Well, it's possible that it was accentuated by weight loss, but very often weight loss will have an impact on eyes, but usually not that much, because it takes a lot to actually lose fat around the eyes. Now it may have been a change for you, and certainly that can contribute to this hollowing. So when it comes to hollowing around in the upper eyelid area, well, the solution for that in our practice very often these days, especially as a first line, is to use an injectable filler. What we can do is place a filler in a special space around just next to the bone, and it adds volume in a way that addresses multiple folds as well as creates better symmetry when the other eye has more fullness. So the opportunity is there to possibly see if an injectable filler alone can make that difference without undergoing any additional procedure. So if I had to just say why the left eye looks more tired, I would say it's a combination of the two issues. One is eyelid position, one is eyelid hollow. Now, that being said, it is very important to have a proper evaluation by a specialist. A specialist will look at you from different angles, take lots of photos, and really evaluate the situation. And then what I typically do in my office when we do a ptosis evaluation, we look at the position of the eyelid relative to the pupil. We see how many millimeters the eyelid can go up, and will that be an improvement? What kind of effect does it have on the other eye? And in terms of the volume, that in itself is something that we figure out whether it's before or after a ptosis procedure. Again, it depends on an individual basis. But to just bring to your attention the basis for the tired appearance, I think you do have reason to at least evaluate those two important elements. So I hope that was helpful. I wish you the best of luck, and thank you for your question.